This is Susan Terry, and this is my master's degree video for Woodbury College. I'm doing a post-divorce mediation with Dave and Trish Michelson. They have contacted me to say that they have a matter they would like to discuss. I actually saw this couple about 3 months ago when we were working out their summer schedule. They've done very well with each other since their divorce. I don't know much about what the issues were. They just said there have been some changes. They need to talk with me in a session. And because we worked well together, I didn't inquire more, and we've now met today. As they were coming in, I've been told that they have a short time today and that we're scheduling another session shortly thereafter. Trish and Dave, good to see you folks again.
Nice to see you.
It's been about 3 months since I saw you. You remember all the terms of mediation, what we expect. I am going to ask you to sign a new document, if you don't mind. And again, it has to do with confidentiality, payment, all of that, if you would do that. Thank you. Now, my understanding is that neither of your incomes have changed, so this subsidy still applies for you, not for you. Okay. And all your mailing address and so forth is still the same. All right. All right, well, you remember how this works, of course, and we meet together. If we need to meet separately, we will also do that. Which one of you want to tell me about what has brought you here and how I can be of help to you today?
Well, I guess the things that have changed specifically is that over the past several months I've come to a decision, and Trish and I are having a hard time working with that. I've been seeing a counselor, a different one than I was seeing before, and through that I've decided that I'm going to have sexual reassignment surgery.
Mm-hmm.
And of course there are a lot of issues with that, and that's why we're here.
Okay. So it's changed some of the dynamics in the family. You have some questions or concerns about this. Is that right, Trish?
Yes.
So what do you need to talk about here in relationship to this?
Well, everything. I mean, the children, of course. How do you tell them? How are they going to react? What's this going to do?
And let's see, Kyle is about 12 and a half, Libby's 8.
Yeah.
Okay.
Yeah.
All right. So.
And for me, it feels like this has all been so reasonably amicable. We've done it, that we've kept the kids and everything, and now it feels like this is the real divorce. I mean, this is the real deal. This is like, who the hell are you? And what did we do? And what have we been doing? And what the hell is this?
Yeah.
I have no clue.
Because when we worked together during your divorce, and then since then, you've worked together very well. Wasn't always easy, but you managed well. Kids are still half-time at each house.
Mm-hmm.
That's worked pretty well.
Mm-hmm.
All right. So what particularly about this comes up when you said what to do about the kids? What does that mean for you, Trish?
Well, we have to tell them. And then, from my perspective, it seems like if Dave's going to be gone for this length of time and have this enormous change in his life, that there's not a way that we can continue to share them 1 week on and 1 week off. I mean, first of all, you're going to be gone, and then you come back and then what? I mean, it's all just, I can't say it's shocking, but it just feels very odd, and like I have no idea who I'm really dealing with, or who have I been dealing with.
How long have you known about this?
Well, not very long, a week or two. Is it a week or two
Right, it's been
now?
a little more than a week, yeah.
No.
Okay, all right.
I know it's not easy to understand that essentially you are dealing with the same person you've always been dealing with. There are some things that I didn't understand about myself that I'm finally, one, addressing, and two, it's making me finally feel whole. And I realized, I wrestled and wrestled and wrestled with the fact that what is this going to do to the kids? Can I simply survive some other way? And I can't. I can't do that. And if I can't do that, then I can't give what I have to the kids, myself. I can't be me. I can't do justice to my relationship with them. I have to tell them. I mean, I can't not do this, is I guess what I'm saying. And I think, with some help, I think they'll be fine with this. And I don't see, other than a period of time, because I will be out in Seattle, and because, there's going to be an interruption, I realize that. But when I come back, I don't see a reason why we can't go back to exactly what we have now.
Talk to me a little bit about the logistics, the timeline, et cetera. When you plan to have surgery, what happens before
Right,
then?
well, as I understand it, and actually next week, I'm going to be starting the first part of the treatment in terms of hormones, which is part of that. And the surgery part of that actually is down the road, because I need to be sure, my counselor needs to be sure, and so forth. So actually, there will be a period of about a year where I will dress as a woman. The hormones will make a big difference in not a big, but a noticeable difference in my appearance. They said I might be more emotional, and so I will, in effect, look like a woman. And the surgery, other than me being gone, in many ways, other than me being gone, there won't be a great difference from, say, 8 weeks before the surgery and 8 weeks after.
Okay. So in about a week, there will be a transition. How soon do you start dressing as female?
They said really pretty much as I start the medication.
Okay, all right. So that will, certainly children have to be told before then. Is that correct?
I would imagine so. Yes, I would think so.
Yeah.
But why didn't you say anything before a week ago? I don't get it. You changed therapists, you have made all these decisions, the children are still involved, we still have to have all this supposedly communication and openness, and I know nothing until it's about to happen. I don't get it.
Trish, I can't just... One of the reasons I switched therapists is because our old therapist didn't understand this whole issue. When I talked to her, she was less than helpful. She wasn't supportive, she didn't offer me resources, so I talked to a couple of people and they said, this therapist, Dr. Moore, that I'm working with now, she specializes in this, she will help you out, but just because I started looking at, working with another therapist and looking at this issue face up, because I had been obscuring it, I had been burying it for I don't know how long. So I needed to be sure, as I worked through some of these issues, that this is exactly what was going to happen. Like I said, if I thought I could suffer through this, if I could change something about this, then I would.
So it was really back and forth for you a lot, kind of wondering, what about this, what about that?
I mean, I would have, I think Trish and I have known each other for so long. I wanted to include her in it, but because I wasn't at a decision point, I didn't feel it was fair. How could I drag you through that? How could I?
You've dragged me through every other freaking thing in your life,
But
so why not this? It seems to me, I still don't get it, Dave. I don't get it. This is like the biggest thing in your whole life. It affects all of us, whether you want it to or not. And here we sit with a week to take it in, figure it out, and say, oh, okay, now Dad's gonna be a girl. I'm sorry.
And so, for you, having just found out about it, it's kind of like, well, you may have spared me, but now I've gotten the whole load all at once.
Not only do I have the load in my lap, I have to do something with it immediately.
Okay.
And,
No full.
yeah, and all this shit is rolling out all over the place.
All right. And is that part of when you say, I don't know who this person is? Is it more about the decision to have the surgery, or is it more about the way he's handled it, of not including you in that?
I don't know that I can answer that honestly.
Okay. So it's.
I don't know. I think
Maybe
it's all so new and fairly enormous. I can't sort it out yet. I can't sort it out. I mean, I understand that you've sorted it out and you're clear, and you figured out who you are and where you're going and how it's all gonna happen. But I'm back at the beginning
At the beginning of what?
of your thinking process.
You were Dave, the dad who was working out what to do about the summer schedule.
Yeah.
And like you say, in many ways, you're the same person.
Yeah, like I said, I'm just finally through going through all of this, and I wouldn't have made a decision if I didn't feel like, I don't know that anybody understands if you're not there, but it was a relief to make a decision. It was a relief not to be wrestling with this. Part of me wants to share that with the kids. I mean, I can't believe they haven't noticed at least some of my anxiety with that. I feel happier. I mean, I know there's a lot of stuff to go through and it's not going to be easy. But I really think that I think my relationship with the kids is strong enough, and I mean, it's not like I'm the very first person to ever do this. There are resources out there to help the kids transition with this.
So let me just ask about the timeline, the suddenness of this for you. Is your timeline is fixed, or are you saying, gee, it would be best if I start this next week, or are you saying, yes, I need to start next week? I'm trying to think about what kind of time you have here.
My feeling is that having made the decision, I don't think the kids are going to benefit from waiting to tell them. This is a decision. It's not something that, because I have taken that amount of time, I have thought through all of that. So I've already thought, well, what if I wait? And I've decided that I'm not waiting.
I've known some about both Kyle and Libby, as you've talked about other issues before. Let's go back and have you talk a little bit about Kyle and Libby in relationship to things outside of the sphere of their experience. How are they with things that might make some people uncomfortable? How are they with race, physical differences, all of that kind of? How do they deal with folks who do things out of the ordinary?
I think they do pretty well. I mean, I think we've done a pretty good job making them aware of people's differences and trying to make them accepting of all those things. And that's not their mother or father.
Sure.
So,
Well, wouldn't you say that, I mean, Kyle, one, Kyle's age, but two, I mean, he's not as outgoing as Libby. I mean, I guess I'm actually thinking that Libby, other than some initial reactions, I think Libby is a bit more flexible. I think she'll adapt a little easier. I'm concerned because Kyle has that whole sports thing that he loves. I mean, and I love it too. I am concerned about that, but
Does that sound like the assessment that you would make of them?
yes, but just the same, yeah, Kyle does kind of internalize more, but I really don't know how they're going to deal. I can see Libby being more, I don't know, just kind of acting out more. And I can see Kyle pulling it in more and kind of assessing what he does next. But I mean, they both just idolize you. And they both idolize all the things that you do. So tell me, are those things going to change? I mean, are you going to be a girl, or are you going to be sort of an athletic girl? What kind of girl are you going to be?
I don't know that I can answer that. I mean, I think that not having to pretend I'm something that I'm not will make me more comfortable.
Mm-hmm.
Now, does that mean I'm not going to play catch with Kyle? No. I love playing catch with Kyle. And, you know, we're kicking the soccer ball around. I guess I don't see that changing. And I don't know if I'll lose a little bit of strength in my legs or whatever, but I don't see that as, I'm not going to become less coordinated. So I guess, kids play catch with their moms.
It's kind of, as I listen to you, or kind of imagine what's going on for both of you, there's both relief, there's kind of like surprise, caught up short, and there's just lots of unknowns, lots of questions which you'd love to be able to answer but can't answer right now. One of the things I guess I'm wondering about is, Trish, if you were to think about how your kids, knowing what their personalities are, how they might be told, what's your thinking about how you would do that, or how it would be done?
I don't know. I've gone over it in my mind. I think it has to come from you. I'm going to carry much too much crap with me to do it in a way that
Trish,
doesn't affect them. You're going to have to tell them, and I have no idea because I don't really know what's going on in your head.
Right. But when you say that, does that mean that you're not going to be there at all?
No, it doesn't, but it also doesn't mean that I'm going to choose the words.
Well, I guess I wouldn't expect you to.
you'd like for Trish to be there when you talk with them?
Yeah, I think, I know that this is new. I know that I didn't give you lots of warning and you haven't had time to process this the way that you like to. I also feel I know you well enough to think that you will process this and you will come to some point, and I'm not even asking you to come to a particular point. That obviously that's up to you. But because we are their parents, just for them to have I don't mean it's a false sense of security, but at least I don't want them to think that this is so contentious that it's going to affect us. Yeah, in terms of, I mean, they know we're divorced and so on, but they know that we're also adults and we coordinate everything.
Is that some of that same sense of stability that you were working for when they were, half-time in each of your houses and never seeing the parents' argument about decisions?
Right.
So how to do that in these new circumstances? I have to come back, Trish, and ask you something. I'm not sure, and you may not know yet yourself, are you kind of entering this from the place of, you're doing what? No, let's have a discussion about it and let me talk you out of it. Or are you coming from a thing of, wait a minute, let me catch my breath? Or from, this is all new to me, let me catch up? Where are you on that?
I guess this is all new to me. And it's much easier it's the same thing for the kids, it's much easier to be liberal when it's not you. And so now that it's in my family, and I have to deal with it, I don't know how I feel about it. I have to sort through that and figure it out. And I feel like I'm being railroaded to do that more quickly than I want to. Maybe I'm able to. I don't know all those answers, but it's a bit of a push.
And because the time is short and you're feeling that kind of pushback on this, a little bit of resistance because it's coming at you.
Mm.
Okay, all right. And when Dave talks about what he feels like he can count on from the two of you as parenting partners, is there any sense of that for you? I know that you had said, I'm not sure who you are anymore, but is there some sense of what you feel like you can count on for Dave, or is right now you don't have that?
Well, I am sure that you will put the children's best interest first, and that you love them, you care about them, you worry about their. I don't have any question about that. But I know who I am as a woman, and it's not who you are as a man, and I have no idea really how you being a woman is going. I have no clue, and really neither do you, until you start becoming one. And so all of those things concern me. And talk is easy, but we're not there yet. And so I do have concerns about that.
Well, I guess that's one of the things that I've been working through in terms of the therapy is there are things that go back in time, and it's one of those hindsight's 20/20. I realize, as much maybe I played sports so much, kind of pushed at it so much because I was afraid of what I was really feeling inside. Now, I suppose that doesn't really help you understand entirely, except that there are parts of me, the parts that like, raunchy jokes, and the parts of me that like to, watch football. I don't see those changing. So.
I'm not talking about those things, but you talked about you may be more emotional. Well, what the hell does that mean? What does that mean?
That means that my reactions would be more.
Like mine.
Well, yes and no. I mean, because my personality isn't going to change. It's the, I don't know, it's like, my sensitivity level,
You don't know.
Trish, is what you're saying is you understand what it is to be female for you. You actually understand some of what it is for me to be female.
Mm-hmm.
You can't envision what it's like for Dave to be female.
No.
Okay, all right. Because nobody has that experience yet in some of the way that you will have it a year from now.
right. That's the point of the year's time is to, one, to understand it, and two, to be
Okay.
1,000% sure.
All right. So you will have a number of things, kind of beginning to dress. You will have to be dealing with your workplace, you'll be dealing with identity, all of that.
Well, actually, because of my workplace, you know, I've got to change jobs. I've already realized that the whole issue of explaining to my coworkers this kind of change, it would be easier for me to start over. I don't really, you know, being an investment person doesn't mean, you know, that's not like, well, that's what I dream about at night. It's a job.
You've always been ambivalent about that job, anyway, yeah.
And so, what do I like to do? I mean, I'm always sitting sketching and you know, even in the office we create, you know, a poster or something, and I like doing that. And so, so I'm going to be, during the period of this year, I'm going to be taking some courses and getting up to speed on being a graphic designer. So, in some ways, the issue of work is going to be different because when I do start a job, I will not be Dave.
All right, so it will eliminate that piece that you will have to do. All right. And so you're now going to be both training for new work and finding interim work, and that will potentially have some impact on the family. And had you known that?
No,
Okay.
no, so there's just one more little piece of information that one must deal with in a week. Thank you.
Even I haven't figured, I mean,
But you knew you weren't gonna stay at AG Edwards. You knew that.
I know, but we haven't, other than talking to you about this particular change and give you time to at least absorb some of that, how can I, you know?
What are you gonna tell the kids? Now I am curious, because I'm getting this in little. So, what, you gonna give it to them all at once? You gonna give it to them in little pieces?
Let me ask you, Trish, before you go
What?
on. Is that question really, what are you going to ask the kids? Because I'm hearing something different in there.
What is he gonna tell the kids?
I mean, what are you going to tell the kids? I'm hearing something that even sounds like, are you going to drop something new on them?
Well, are you gonna do it all at once? Are you gonna do it in pieces? What's that gonna be like? I mean, it just, this doesn't work for me.
Okay.
Well, what sort of piece? I mean, yes, I didn't talk to you specifically about the job, but that's just a matter of me realizing I can't go through that process at.
Well, this is all a process of you realizing, you're realizing you need to be a woman, you're realizing you can't do a job, you're realizing you'd rather do something else anyhow. But none of this realizing has been shared at all, and so I am only realizing it now. So while we're realizing, I assume you're not gonna call yourself Dave. What the hell are you gonna call yourself?
I'm gonna call myself Elizabeth.
What?
Elizabeth?
That's Libby's name.
That has nothing to do with it. That's.
There's nothing in a name? Oh, dear God.
And your reaction to that is?
Well, it's your daughter's name. How can you take your daughter's name and make it yours?
Taking her name?
Okay, so you're using her name.
No, I am using
Is-
a name.
Is it feeling that it will be difficult for Libby?
Yeah. Yeah, it just feels like, I want to say violation, but I don't know if it's that strong, but it doesn't, it's her name. We gave her that name, and then, it's one thing if you name your child after yourself, Junior, or you know, Big Joe and Little Joe, or whatever that is, but,
To name
you know,
yourself your child's name seems
it
odd.
seems odd, yes. It all seems odd.
You know, as I listen to you, one of the things I think about is your divorce. And Trish had a lot of questions for you. Why, Dave? What can I do? And they were all questions you couldn't answer. And some of that is happening again today. There are things you can't answer because you don't know. And the thing I remember the most about your divorce is you're saying, I don't have any choice here. I didn't know, in your sense of feeling complete powerlessness.
Inadequate.
And it looks like
It feels the
happening.
same again,
Okay.
that, you know, I can argue this, but really,
Okay.
I'm not gonna change anything, am I?
No?
No. And that isn't, you were absolutely right, that isn't any different
All right, so
than it
that's
was.
one of the things, is it feels a little familiar about another hard time which you actually made it through, but here you are again. Let me just show you something you've got, and then I have a question for you. Here's some of the experience you have. You've got a whole bunch of questions like logistics, timelines, when you make certain changes, when you leave the job, when you go to Seattle. You have some stuff around your relationship and communication and trust, etc. Got a bunch of questions around the kids. When you tell them, how you tell them, what name, if that's going to relate to that. You have a whole bunch of stuff probably now coming up around finances. And then, even though this is, I have kids over here, I'm going to put a thing around living arrangements. What you do around the Seattle time, how you manage that, etc. Okay. Have I left any areas out? I mean, this is a big amount of stuff.
Mhm. I guess my job is under the, well, I suppose it's tied in a couple of
Yeah,
these places.
finances, job, yeah. If you had to say, for purposes of today, and I know we have a meeting next Tuesday, but in the remaining 25 minutes, what would be most helpful to you to focus on, to feel like you're getting a little bit of traction on this so that you are just not constantly scrambling?
I'm gonna throw that at you, Trish, only because I'm willing to make sure that these transitions are as easy as possible isn't the right phrase, but so in other words, I mean, I know this whole job thing just came up. I have enough money set aside for what I feel like is 5 or 6 months that it'll take me to do most of the coursework and, you know, potentially find something else. But
Say that again, I really wasn't, was someplace else, how long?
5 or 6 months. So that, I guess my immediate concerns are talking to the kids, but if you have something else that specifically that you want to address, please tell me, because I'd rather focus on that.
Okay.
I have been focusing a lot on all of those issues in regard to myself, but what do you know?
Where would it be most helpful for you to feel like you're getting a little bit of move forward? You're really struggling right now, aren't you?
Mm-hmm.
Yeah. All right, just take a moment, tell us what you're thinking, where you are.
Well, the kids have to know. I mean, they have to know, because it's way too big an elephant in the middle of the room to ignore it for very long at all. So that has to happen.
Okay.
And then beyond that, I don't know, I mean, I look at all of those things and it's like, I need to know it all,
Okay.
because I do,
Okay.
because that's the way I function. I have to have the rest of those ducks in a row so that I can continue to breathe and do what the kids are gonna need done.
So shall we start talking for a few moments about what the children will be told and how they'll be told?
Sure.
Okay. My first question for you is, what is the fundamental thing that you want them to experience as they're told? More than anything else, what do you want to have happen for them?
I just want them to know that we both love them and care about them.
Okay. All right.
And I want to make sure that they realize that, I mean, changes happen to adults, whether it is a change in job, especially in a divorce situation. Sometimes people have to move apart, and I want them to have some sense of security that regardless of those changes, that they're going to be okay, that they're going to be taken care of. Taken care of sounds too, but I mean, they need to continue to have that, not worrying about their life, that part of it. I mean, they should worry about schoolwork or.
Yeah. They can be carrying their life on and not having
Yes.
to worry about yours. Okay. They're going to want to know, what does this mean for me? What difference?
And that's where I think, logistics come into this. Are they gonna continue to go back and forth? Are they not gonna continue to go back and forth? And, all of those kinds of things, because they're gonna need to know that.
All right. So that's one thing we'll put down as a whole pile of logistics.
Right, but I guess because I'm not going to be out in Seattle until a year from now, that at that point, I mean, so in other words, are you suggesting, Trish, that we change that arrangement now before I go to Seattle?
Well, quite possibly. Yeah, I mean, that's one of the things that's,
Because I think that sends the wrong message to me. I think that if suddenly, you can't be with Dad as much because, that's not the right thing or whatever, or that they'll reach some conclusions on their own because that's what they'll do. I think steady state is the way to go.
you may be right, you may not. I don't know. I'm just a little overwhelmed at this point.
Okay, so it's hard for you to think about. As I think about this, and I know there's surprise in there, and you're each struggling to be respectful of each other, and there's kind of a tone of sadness that you're having to deal with a difficult issue that might impact your kids' lives. And this is in the middle of something that for you has been an amazing revelation and a decision that brought you a lot of relief. So I'm trying to think about how, what's the most helpful way of talking about this that kind of honors where both of you are. You're not in the same place of celebration, And you don't want to have to be sad about a decision that you've made that is good for you.
I guess I'm just sort of envisioning having some kind of family outing, kind of someplace away from both of our homes,
Mm-hmm.
someplace where there's some open air, because, I guess I don't see it as a, chat over lunch kind of thing. I'd rather have it, let's talk, you can go off with your, the kids can go off if they need to, and Trish and I can talk, or I can take a walk with Kyle. Just having some options for at least an afternoon, but I really think, kind of a late morning. I don't know, I don't want to force us together either, but I want to make it as non-threatening as possible for the kids.
Mm-hmm. What do you think, Becca?
Yeah, it makes sense. In my head, it makes sense. In my gut, I don't know. And now I'm beginning to think, well, maybe this is cause for me to celebrate as well, because for God's sake, the failure wasn't mine. I mean,
The marriage
the
itself.
marriage, it didn't work. Probably never would have worked.
Well, I never said it was you.
It didn't matter. It was sort of the way that it shook out. I felt like, what did I do? Why can't I make this work? I kept asking you that, and you couldn't hear it. So here we are again, where you've kind of figured yourself out, and I'm sitting here feeling like, oh shit, I got egg on my face again. And, maybe not.
And it's,
So again, if there had been more time than a week to be talking about this and making these plans, I might sit in a very different place, but this was your choice, not mine.
let me ask you, logistically, you're going to begin the hormone treatment next week. Is there any reason why that particular week you need to change your dress, or can you wait a short period of time?
It wasn't how it was presented to me. Quite honestly, it's one of those, now that I've made the decision, I really feel like waiting is, I'm struggling with that. I can't.
And I wasn't asking you to, I was just trying to think, you've got an appointment next Tuesday. Probably be best if you talk some of this through a little bit more before you talk with the kids. You will have a little bit more time to process some of this. Just trying to give you every advantage we can here. So that was interesting, Trish, just even thinking of, okay, well, it's another piece of information about the marriage, about what happened there. Give me a chance to process it, I'm hearing you say. You're having trouble thinking about the specifics of how the getting told, because you're dealing with a whole lot, but intellectually at least, a family outing sounds like an okay idea. Let's think about it a little bit more, okay.
I mean, I certainly don't, I won't do anything in terms of the dressing, so certainly until after both Trish and I talk about also.
Yeah.
Hopefully we can come to a place so that when we come back next week, that some of those things will be clear in terms of a little bit of the timeline. I don't see any big change in that, but and I've also got a session scheduled on Friday with Dr. Moore, so
All right.
maybe I can pose those questions in the light of our conversation.
Let me ask what, just in terms of thinking about telling your kids, what resources for your children have either of you thought about? Any material that, should they want it, they may whether that's videos, information, other people they can talk with.
Well, Dr. Moore's indicated there's resources, but I didn't ask specifically what they were, so
There's some, there's a lot of really wonderful stuff out there. And children, of course, are going to be figuring out how this impacts their relationship with other kids. And sometimes other kids who've had a similar experience are a very good resource for that. So you might want to start searching that out. Think about that.
I guess I am, in some ways, I'm a little concerned because in a small town, it's not likely that they're going to find that connection as locally, but...
Not likely they would find it in the small town, but there may be other ways of doing that, whether it's by internet or in a nearby town. Who knows? I don't know.
Oh, I don't either, but...
Yeah. So, but you can follow up with Dr. Moore.
Absolutely.
Do you have a resource you can look to see what might be there for the kids?
I can start asking some questions.
And you folks know your own kids. You know about how open they are, how easy they are with accessing this sort of thing. So you'll have to use your own judgment about it. So what you have so far is knowing you have a bunch of logistics to deal with, kind of living arrangements that you're thinking about, not even that you're saying, no, they shouldn't be living with Dad. You're just kind of not being certain about that. Kind of how the kids react, all the kinds of related questions. The two of you, your relationship, how you can get back on a kind of a steady course again. Impact on finances, although it sounds like you're okay for a period of time. So you can do some of your courses, etc.
Well, I guess one thing that I hadn't thought about, I was just looking at that in terms of job, is that I don't know if I can continue with my insurance company. I mean, I can ask whether for the next period of time, maybe 5 or 6 months, can I just make the payments and stay on AG Awards plan.
So will you contact them about whether you can COBRA on that plan? Reasonably sure, but what the conditions would be, so that Trish and the kids would be on it. You don't have insurance through your work.
No, town can't afford to pay that kind of thing, and I certainly don't make enough money to not be part of some kind of group or employment thing. No.
Just a side question about finances. When you said you thought you were right for 5 or 6 months, does that include continuing to pay the child support to Trish? Had you not thought about that yet?
I hadn't really thought about that, I guess, directly. Although since it is part of my monthly bills, I guess I wasn't not thinking about it. In other words, I wasn't looking for things that I was cutting out over the next 5 to 6 months. I was really hoping that with the little bit that I got to put aside, that I can, so that as long as I've got something that, even if I find something temporarily, it'll be, might be a little tough for a short period of time, but I don't see it as a long-standing thing.
So one thing you might want to do also as part of your homework is take a look at your finances, see if you've figured this correctly. And in fact, how long can you go? Because you're going to have some expenses you've not had before. You're going to have some additional trips to Seattle. You're going to have some clothing or other kind of expenses you might not have counted on.
If you don't have insurance, how will you pay for this?
Set aside some money to do that. The rest of it I'll borrow and pay back.
So realizing that the brain is probably pretty full for each of you about all the things that are going on, you've got a whole bunch of work to do over the next few months, and a whole lot of kind of being with your kids, kind of seeing that you that you keep all the things about your family that have worked really well there, as you figure out a new piece. All right. You need to, I'm hearing you say you've got to get some of this cleared out and figure out how you do feel about some of this. You've taken kind of a first step in looking at how you might tell the kids, but am I correct that you're not telling them at least until after Tuesday's session? Is that correct?
Right, yeah.
Okay, good. All right.
I have some things I think Dr. Moore can maybe even point me to a resource or two specifically about that. We've talked about it, but we haven't detailed out anything, and I was kind of hoping, I certainly don't expect Trish to necessarily want to come to Dr. Moore's office, but...
Is that a correct assumption?
No. Might be quite useful. Might have been quite useful. But certainly would be useful now.
Well, then, if you do feel that way, then I think, that may be a way to, maybe she can answer some of your questions that I can't, because I'm the patient enough that I feel. I really do want you to understand this. Not just understand as accept, I really want you to understand.
All I can say is I can try, but I can't make promises. Or I won't make promises.
It sounds like you want to do everything you can to at least get a picture of what is going to be happening, as much things as you can be told, what the doctor knows for a fact, or what best guesses are. And that may contain some information about how to be helpful with your kids, 'cause entering territory here you've not been on before. All right.
I just never imagined parenting with a girlfriend, that's all.
Well,
And so it's a whole new concept in parenting.
So let me ask you, what kind of relationship would the two of you like in the future? I know what you said about the past. What would you like in the future?
Well, we've always been good friends. I certainly wouldn't want to lose that friendship. But as I said, I never quite imagined parenting with another woman. So I have no clue what that might feel like or look like. So again, I don't know.
Yeah.
One thing that I've been wrestling with through Dr. Moore is that in some cases it's an opportunity to start. You have a relationship with somebody, but it's as though you can start it again.
Mm-hmm.
And I don't mean that, it sounds kind of funny, I know, Trish, but at least there's an opportunity to create a relationship that something that you and I could still be, kind of doing the co-parenting type of thing. I don't know that it would make it, the decision wasn't made to make it easier or more difficult for you. It's me. I needed to work through this and get to a decision point.
And in the future with Trish, the relationship you'd like to have with her?
Like I said, I'm not sure. She and I have known each other for so long, and I still feel, there's an emotional attachment that, regardless of the divorce, it's not as though I can just sort of dismiss, more than, we were married for 11 years, and and together for so much more before that, I can't not care about how she feels about this. I can't, you know. I guess I want to have at least as solid a friendship as we have.
And am I right in hearing what you're saying of, it would be good to be in good relationship, but as kind of thinking of co-parenting with a girlfriend or anybody else you're on good terms with, I reserve the right to be ticked off when I feel like I need to be. Okay, so that goes along with the package. And do you understand that?
Oh, of course. The idea would be that as difficult as some of that would be, I'm hoping that just as now, we sit down and we work it out. If we need some help, we'll come see you.
So here's what you have. We're very close to finishing. You, in the communication with the children, when you tell them, the main thing you want them to come away with is a sense of being loved and cared for by both parents. That changes happen, many changes that you haven't quite expected. You want them to have a sense of security. There are some logistics you'd like for them to know about. Some of that you may be a little more prepared for, having seen Dr. Moore, who may be able to give you some advice. Thinking that maybe a family outing, the sense I had you were describing is some sense of freedom, so it's not enclosed. You could kind of walk away or go someplace else.
Well, only because I'm not sure how any one of us will react as things unfold.
And allowing your kids to have their own reaction and be with them through that. And so you'll think more about it. We'll come back and figure out. One of the things you're going to be paying attention to as you sort this out is a little more thought about, does there need to be a change in the living arrangements, or are things okay, or will you only know that after you've talked with the kids, whatever. You will talk with them about your company about insurance. You'll take a look at your finances. Can you really manage? What does all this mean? Do you need to ask Dr. Moore if you can bring Trish, or was that just assumed?
Oh, and I would have to speak to her. I don't see a problem with it, but it just wouldn't be fair.
All right. Anything else you think of that need to be said today? It's not like you've already haven't got too much in your brain here.
Right. I don't think so. I think I'll have more thoughts next week
Sure.
than I do right now.
Okay.
Yeah.
Yeah.
I do want to say I'm sorry. I mean, it wasn't easy to get to the decision part, but I wasn't trying to to exclude you as much as I couldn't. If I were halfway through that process and hadn't made a decision, at least I'm clear about making the decision. If I wasn't there, then I would have told you things that wouldn't necessarily have been true at that point. I might have told you somewhere in the middle of this process, well, I thought about it, but I'm not doing it. And then to wind up reversing tracks, I felt would be even more unfair. So, yes, I would have wished that you and I had been in a different situation, so I could have included you more, and I am. I didn't want to do this in a way to upset you, but I could not figure out anything else.
Well, I appreciate that, and I don't know how I feel about that, but thanks.
Are we at a closing place for today?
I think so.
All right.
Yeah.
I will see you next Tuesday at 3 o'clock, I believe our session is.
Mhm.
Okay, thank you.
Thanks.
Thanks.